Healthcare aide provincial exam. Let's get started. When a resident refuses a bed bath, the nurse aide should. Is it A, offer the resident a bribe? Or B, wait a while and then ask the resident again? Could it be C, remind the resident that people who smell don't have friends? Or lastly D, tell the resident that nursing home policy requires daily bathing? The correct answer is B. Here is why. Respecting refusal and revisiting the request later allows time for the resident's mood or condition to change and demonstrates respect for autonomy. Offering a bribe is unprofessional and manipulative. Using shame or social pressure is emotionally abusive and violates dignity. Citing policy as an ultimatum ignores the resident's right to refuse care and can create a power struggle. Next question. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to. Is it A, show the resident that the nurse aide is in control? Or B, call for help to make sure there are witnesses? Could it be C, explain that if the resident is not calm, a restraint may be applied? Or lastly D, step back to protect self from harm while speaking in a calm manner? The correct answer is D. Here is why. The priority is to ensure personal safety to avoid injury, which allows the aide to remain present and use de-escalation techniques from a safe distance. Attempting to demonstrate control can escalate the aggression. Calling for help is important, but the immediate action is to create a safe distance. Threatening with a restraint is coercive, likely to increase fear and aggression, and restraints require a specific clinical justification. Next question. During lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to. Is it A, remain calm and ask what is upsetting the resident? Or B, begin removing all the other residents from the dining room? Could it be C, scold the resident and ask the resident to leave the dining room immediately? Or lastly D, remove the resident's plate, fork, knife, and cup so there is nothing else to throw? The correct answer is A. Here is why. This de-escalates the situation by addressing the potential cause of the behavior in a non-confrontational way, showing concern rather than reacting to the aggression. Evacuating other residents may be an overreaction and could further agitate the resident. Scolding and demanding removal is punitive and will likely increase agitation. Removing items may be a safety consideration, but it should be done calmly and after attempting to understand the cause. The primary response is to address the resident's distress. Next question. Which of the following questions asked to the resident is most likely to encourage conversation? Is it A, are you feeling tired today? Or B, do you want to wear this outfit? Could it be C, what are your favorite foods? Or lastly D, is this water warm enough? The correct answer is C. Here is why. Open-ended questions that invite the resident to share opinions, memories, or preferences promote richer, more engaging dialogue. Questions about feeling tired, clothing choice, or water temperature are closed-ended, typically answered with yes, no, or a brief phrase, which does not foster extended conversation. Next question. When trying to communicate with a resident who speaks a different language than the nurse aide should. Is it A, use pictures and gestures? Or B, face the resident and speak softly when talking? Could it be C, repeat words often if the resident does not understand? Or lastly D, assume when the resident nods her head that the message is understood? The correct answer is A. Here is why. Nonverbal communication tools like pictures, gestures, and demonstration are universal aids that can help convey basic needs and instructions across language barriers. Speaking softly may make it harder to hear. A clear, normal tone is better. Simply repeating the same unknown words is ineffective. rephrasing, or using aides is better. Assuming understanding from a nod is dangerous, as nodding may be a polite gesture or sign of confusion, not comprehension. Next question. While walking down the hall, a nurse aide looks into a resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to: is it A, contact the state agency that inspects the nursing facility, or B, enter the room immediately to provide for the resident's safety? Could it be C, wait to confront the nurse aide when he/she leaves the resident's room? Or lastly D, check the resident for any signs of injury after the nurse aide leaves the room? The correct answer is B. Here is why. Witnessing abuse requires immediate intervention to stop the harm and protect the resident from further injury. Reporting to an outside agency is a necessary follow-up step, but protection of the resident is the immediate action. Waiting to confront the abuser allows the abuse to continue and fails to protect the resident. Checking for injuries later is important, but occurs after the abuse has been stopped and the resident is safe. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.